So
Okay.
welcome all to another Vartaalap of HomeoMitra. This is a podcast that HomeoMitra organizes. HomeoMitra is a social media management company for homeopathic doctors. Uh, we welcome Dr. Ananya Chitale today on the podcast. She is a consultant psychotherapist and a homeopathic psychiatrist. Uh, he is someone who is an expert in kind of both the fields, psychology, psychiatry, as well as homeopathy. Uh, my senior have learned a lot from her in my UG days, in my PG days, and till date. Uh, so, and we, I asked her that should we take this topic, whether it will make any sense, whether it will help. The topic of Dr. Heal Thyself, and she gladly agreed, and she said, yes, this is an issue which is not really touched upon, and we need to work on this. So, I, I would like to understand, Dr. Ananya, that when we talk about this particular topic, and as I shared with you earlier, I did a little homework, and then I figured out that there is not much research on this topic. So, for example, the only overall figures which were seen in some of the research papers were taken from newspaper articles which were published online. Number of
Yeah.
doctors having depression, number of doctors committing suicide. One survey was done internally in a certain institute where it was an email survey, not even a one-to-one conversation. So, why do you think is such a? I mean, why such a state of affair wherein the doctor's mental health is really not, a focus of attention?
Yeah. So you're very right, Dr. Keyur, because even when I was kind of searching on this, I did not find too much of survey beyond some surveys which were focused on mental health of medical students, but very less for doctors. So let us go back to the residency days or even to the internship days. In our culture at least, or in our Indian medical schools at least, somewhere you will find that working 24 by 7, staying awake for 48 hours, not going without food, not having water, not taking care of yourself is glorified. Okay, okay, itna hard work kara hai. It is good, huh? That means you're a good resident, right? So it is a kind of reinforcement for our own behavior that no, I should keep going. I should not get emotional. I should not raise my needs. I should not take sleep. Because that is how people will look at me as a good doctor. But if I start complaining that I need rest because I'm running 103 fever, or I need rest because today I'm feeling very low, just yesterday there was a death in Iceland and I couldn't deal with it. And if I ask, even if I mention that I'm getting disturbed, there is a thing that either consultants or your seniors might tell कि इतना weak रहोगे तो कैसे चलेगा भाई? So unfortunately, within doctors or within medical fraternity itself, you will see lack of that sensitivity and sensibility to understand that mental health and mental health issues, or same way physical health and physical health issues, just because we're doctors, we're not immune to that, right? So unless and until we see that as something happening just like to our patients, to us also, we won't see it as a problem to even go and research about it. कि अच्छा मतलब डॉक्टर्स को भी डिप्रेशन है तो कितने डॉक्टर्स को डिप्रेशन है, क्या कॉजेस हो सकते हैं. सो यू वोंट फाइंड टू मेनी रिसर्चेस अबाउट दैट बिकॉज डॉक्टर्स themselves don't see it as a problem many times. So we have to stop glorifying and in fact start normalizing the conversation that doctors or psychiatrists can go through a depression, just like an ENT surgeon will go through his own bouts of cold and cough, right? And he has to take rest. Just because he is an MD physician, that doesn't mean that he won't become hypertensive or diabetic, right? So we have to consider ourselves also as humans and not superhumans, and stop suppressing or shutting off the signals that our body is sending. Be open about taking care of ourselves and be very vocal about it. Unless and until we see that doctors also go through this problem, there won't be any concrete steps or research done for that.
Agreed. I mean, even if you look at competency, if a doctor says that I'm not feeling up to it, and competence of the doctor is questioned, whereas it may be
Exactly.
phasic. There could be a cause
Exactly.
behind it, and probably if it is taken care of, then the doctor will be able to perform better.
True.
Now, having said that, I also realized that we don't have the data on Ayush doctors. The data that was published It was an allopathic doctors. Now I wonder why, although I mean, I sometimes feel that we have got a robust system of medicine which keeps our mind and body both holistically
Together.
healthy. I wish
Yeah.
that that is the only reason and no other reason. But yes, I
Yeah.
also feel that maybe your thoughts on this, Ayush medical practitioner, especially let's say homeopathy, we also need because the kind of things we hear from people when we take the history, it is something that a person who just, like someone who's a family practitioner, or even for that matter, any allopathic doctor other than a psychiatrist or a psychologist, especially a counseling psychologist,
Hmm.
would not have heard. So, what are your thoughts on homeopathic doctors having to deal with this?
Yeah, because see again, being homeopaths, fortunately or unfortunately, I would say that every case that we see, we enter into the mind of that patient, and we may not be even trained to with the basics of counseling, or we may not be trained to understand the difference between empathy and sympathy, or understand where to set the boundaries when it comes to patients tend to overshare with us sometimes when we are even not ready for that. Patient is coming for treatment of diabetes, and by default we tend to take a detailed case which includes understanding of mind as well, and in that process either patients tend to overshare or we are not prepared for certain things, and plus not all homeopaths are trained to handle their own sensitivities which might get triggered when listening to patient stories, because we most of us are not trained counselors, right? So it can become overpowering for homeopaths specifically, or very difficult for homeopaths to address their psychological health when they're dealing with so many patients and understanding and listening to their stories. So again, I think a problem which is very underrated, that which we homeopaths ourselves don't give priority to that. Again, maybe because of lack of awareness that, even though I'm a homeopath, I also might need a counselor. I also can go through. We don't know what is a burnout. We don't know what is an imposter syndrome, right? So many things we ourselves are not aware to understand that we need help. Again, then if we are not aware, why will some homeopath think कि अच्छा homeopaths को भी stress आ सकता है? Homeopaths can go through emotional burnouts. So can we go and research about it? Right? So again, lack of awareness, lack of that sensitivity towards a doctor and his own physical and mental health again becomes the reason for not even having data on Ayush doctors.
So, on that note, I would request those who are listening right now to us live and later on, whenever this podcast gets posted on YouTube and other channels, that dear homeopaths, what do you think about this? What we just discussed? And I see two possibilities over here. The first possibility is a kind of a well-designed course where the homeopath can learn this aspect. Now, not everyone does MD in homeopathic psychiatry. That doesn't mean that they will not get patients who are going to suffer from psychological issues. So one is sensitizing and orienting them and probably educating them in that sense. The second possibility I see is having some kind of a workshop where the homeopaths can unwind, or at least they can be trained in a way, because it is not possible for the homeopath to always go to a counselor. So if there is
Correct.
some sort of, so these are two possibilities I see. Any thoughts on those
Yeah,
possibilities?
definitely. I would say if you go back to our parent college, MLT, MHI, we at least had those sessions of sensitivity
Mhm.
training, or, introspecting yourself, what has happened to you when you were taking the case. But still, we don't have that kind of a system in all homeopathic colleges, which can help you to introspect what is happening within you when you're listening to a story. Is there any unresolved conflict within you that is coming up? So unless until that training is given even to a homeopath or to an Ayurvedic physician, they won't be in a capacity to recognize what is happening to themselves. And if they don't recognize, they won't understand where and when to take help, or what to do about it.
Agreed. So on that note, I want to understand why should a doctor, a homeopath, all the doctors in that matter, should make healing yourself a priority.
Yeah. Yeah, see, because it becomes important in today's times even more for the kind of world that we're living in. With the digital technology creeping in into our day-to-day lives like anything, what has happened is the boundaries have become very blurred. Okay. So that, there is this constant. So even if I'm not in my clinic, because I'm available on WhatsApp, the boundaries are blurred. People think, or your patients might think, you're 24/7 available. Unless, even if it's not an emergency, they might still contact you. Right? Same way. our relatives for that matter, right? Sometimes I know that there is a relative of mine who has not been in touch with me for like years. And they out of nowhere text me, ki, you know what, can we have a talk? I need to discuss something with you. I know where this is going, right? So initially it was a struggle to set that boundary because we know so many people, we know so many relatives, everybody, if they start calling us and just discuss and have our opinion, how are we going to, manage our practice and home in 24 hours that we get? Right? So that clear boundary setting is even more needed in today's times. Keep not being available every single minute for every single person that who tries to connect with you. We all are there on social medias, WhatsApps, and you keep on getting so many DMs on LinkedIn asking ki, I want to connect with you, or when can we talk? You have to maintain a clear boundary over there, right? And most of us are not able to do that. Why? Because, there is this an emotional need within each one of us to feel important or to be made feel important, or there is an emotional need for validation ki, oh, that doctor is always there, so society also admires the doctors are always there available 24/7 no matter what. I have little opposite thoughts about it. I would say that you should stop being available 24/7 because that is a primary reason for your burnout. Every doctor knows कि भाई I cannot be there 24/7, but जब patient का call आता है and you inner mind says कि don't take that call, you're tired, you need to go to sleep, and still you take. Okay, so that conflict itself gives rise to stress. So somewhere we need to learn to say no at right places. We need to learn to say yes at right places. So, when I say about boundary setting is all about, it's a form of self-care basically, right? And if you don't do that, you can find yourself stuck at the phone or answering emails and DMs of your patients 24/7. And then, as I said, there is this emotional need. Many of us are doctors because there is an unfulfilled emotional need within us. Some of us are doctors because of a personal story behind us. जब मुझे जरूरत थी तभी कोई डॉक्टर नहीं था तो मैं वो डॉक्टर बनूंगी या बनूंगा. So then, if you bring your personal stuff in your profession, you are yourself blurring the boundaries between professionalism and personal life. Right? So you need to question why am I a doctor? What is going to my availability? Yes, there are certain cases which are real emergencies where you need to be available at times, but you need to choose that. Right? Everybody cannot keep on texting you and you cannot keep responding to everybody. Plus, there is a fear nowadays, right? That if I don't respond, maybe I will get a negative feedback on Practo. And everybody will know that, okay, I'm not available, I'm not good doctor because I was not there at 2 a.m. in night. Right? So you have to shed off all those kinds of fear of getting trolled or fear of criticism, which is unnecessary. You need to shed off those fears. Otherwise, you forget healing, you will not even get space to breathe in today's time. So setting those boundaries very clearly is important because that is how you will let others see. People won't come to know. Your patients or relatives will not come to know that because they don't know your life, right? They don't know how busy you are otherwise. So you have to tell them, you have to open your mouth and say, no, I won't be available right now. If there is an emergency, please connect so and so. There is a way of boundary setting. You don't have to say, no, I won't see the patient right now. No, it's not that way. There's a proper way of setting a boundary. Ki, right now, I might not be available, but if you need, you can connect at so and so number and you will get the help needed. Right? So not being available is very crucial if you really want to be in good state of health or even heal yourself, because that is the way you will honor your needs and even feel respected for yourself. So that eliminates half of your stress. Right? And the other aspect that comes in between of healing yourself is the imposter syndrome. Okay. Now, what do you mean by imposter syndrome? Imposter syndrome is where you yourself keep doubting your own accomplishments. You keep feeling like a failure. You just keep feeling as if you're not good enough. Okay. And then to this, what is added is fear of being exposed. Okay. You tend to disqualify your successes and you rather just remain stuck to one negative incident where you might not have been able to cure a patient or you might not have been able to treat a patient. Unfortunately, the problem is that our brains are primed by default to remember negative experiences more vividly. Right? So one case, if I'm not able to treat, that case will get stuck in my mind, making me question, why am I even a doctor? Do I deserve to practice? do I deserve this medical degree? I am not good enough. So then next case that I'm going to take, I will be reminding myself again and again, ki, oh, but you know what? You did not cure that case. Are you sure you want to take the case? Right? So these self-doubt keeps on coming again and again. And I think it is even more common for homeopaths, and specifically in your early years of practice, because for homeopathy, every case of cold and cough is also different. So you might have cured 10 cases of cold and cough, simple cold and cough, but it is possible that 11 case might not go the way you did. And that becomes a trigger for imposter syndrome, right? So you have to be very careful of all these thoughts that might plague your mind. Okay, usually imposter syndrome stems up from wanting that kind of excessive perfectionism, or it can come from self-doubt or low self-esteem. All these are various reasons for imposter syndrome to come up. And if you don't understand that from where it is coming, you will be stuck in a vicious cycle of continuously questioning yourself, which can lead to overthinking, and this overthinking finally will lead to burnout, which is self-imposed. People are coming and telling you, okay, doctor, you are doing amazing job, and you are still telling, no, but that one patient, I did not cure. Right? So you are yourself disqualifying the positives. You are yourself disqualifying the accomplishment. You might even say yourself, saying, ki, wo to luckily ho gaya, by chance ho gaya, take. Right? So if you are experiencing this, you're already in imposter syndrome and you need help. Okay? So imposter syndrome, blurred boundary lines, inability to understand the difference between constructive criticism and random trolling. These are all the causes that are somehow important for our mental health or psychological health as a doctor to get compromised.
Agreed. And I also again now every time I listen to what you are telling to the audience, I realize that there is so much more that should be part of the curriculum in medical schools.
Yeah, true.
Right. Would you be able to comment a bit on the different types of psychopathology that there is a possibility that a doctor might experience, considering now obviously the symptoms are going to be different, but then generally speaking, that whenever a doctor goes through certain experiences, what are the possible psychopathologies, meaning mental health issues that a doctor can face?
Yeah. So it won't be an exaggeration, but I would say any doctor can have any kind of psychiatric issue. It can range from simple depression to a major depressive disorder to anxiety, which can be basic neurosis, or it can be panic disorder, say leke, it can be even somatoform disorder. Okay, so the point here is that no doctor is immune from any of these conditions, right? So it becomes very crucial. And again, the reason why we are all not immune, because understand, we are in a high stake job. Okay, most of us are in a position where even as a psychiatrist, what I say, what sentence I say might define somebody's life, might make or break somebody's life. Same way, if you're a homeopath and if you're treating a crucial case, it has a potential to land up a patient into fatal complication or cure. Right? Yeah. So it doesn't matter if you're an intensivist or a gynecologist or a homeopath. Of course, gynecologist and intensivist, they are though literally into facing death and life on a daily basis, right? But then overall, if you see, our jobs are high pressure jobs. Plus, there are no, it's not like a 9 to 5 job where we have a routinistic work. As I said, that every new case is a challenge. Every single case of depression is different. The remedy is different. The therapeutic approach is different. Therapy might be same. If I'm using REBT will be the same, but the way I'm using it differs. So it demands lot of cognitive work that we put in, apart from the physical work that we are putting in. Physical work because you're sedentary, right? And that is already compromising your body big time. So you're putting a lot of cognitive work, there is a lot of cognitive pressure, stakes are high, and plus the field is very evaluative in nature. Okay, so unfortunately we don't get always, all of us are not blessed enough to have colleagues who are into healthy competition, right? We see that doctors tend to, put down some doctors or demean doctors. Psychologists demean or put down psychologists directly or indirectly, right? So we are in a very critical and an evaluative field. Forget patients, wo kya feedbacks dete hain, that is so altogether a different story. So probably we belong to a kind of profession where we are facing lot of people. There is lot of cognitive workload. There is lot of criticism. There is lot of pressure. There is lot of everywhere you can be questioned. There are legalities associated with lot of cases that we deal with. There are moral conflicts. I still remember one case that recently we had, that the girl had gone through sexual abuse and she was not ready to report it to POXO and all of that. So we could understand why she did not want to report it, but it was quite a conflicting situation to make her realize that reporting is compulsory, and then getting them convinced to the reporting and all of that. So we're always stuck between lot of moral conflict, ethical conflicts, right? And it is on a day-to-day basis. And that is why the burnouts are common, stress is very high, and if it is not managed well, then be prepared that you can land up into depression, anxiety, somatoform, any kind of psychological disorders, just like physical health issues. So again, Dr. The Heal Thyself becomes extremely crucial. Plus, you want to visualize how you want to look yourself as a practitioner. Are you looking at somebody who is working 24/7 and then dying suddenly at the age of 40 and 50? Or you see yourself working and serving the community till the age of 70 and 80, right? So if that is the goal, that you want to give your best to the community, you want to serve the community, and you to do it in long run, to lambi race ka ghoda hona hai, to you cannot shut off the signals that your body sends. You have to identify them, you have to respect that, and take proper steps for that.
Having heard this, this almost sounds like mental health issues are an occupational hazard for the medical professionals.
Yeah.
Anything that we can, as a homeopathic psychiatrist, we can do about it, or as homeopaths, this may sound like, okay, I understand allopathy is also important, but since we are on HomeoMitra and we are talking about this, anything that homeopathic psychiatry can offer preventively, therapeutically for these issues?
Yeah, I will give some quick understanding what I feel at both the levels, because I'm also a psychotherapist. So as a homeopathic psychiatrist, I think definitely, first of all, as a homeopath also, we are definitely in a better position to understand what is happening to us. If we are trained to understand what happens in patient's mind, although we are not trained as a counselor or as a psychologist, right? Plus, Hahnemann himself has given us so many guidelines at how we as a physician need to be, isn't it? Right from being unprejudiced observer, say like a medical observer, how we are supposed to be. So if you see those guidelines by Dr. Hahnemann, we have to be really in the best shape of our mind. Right? So if those guidelines, being unprejudiced, being sympathetic, being alert, being accurate in your observations, so all these faculties are compromised, it means that you know that you are needing to take some steps for that. You are not psychologically healthy. So Hahnemann has clearly given us the guidelines at how we as a homeopath should be mentally also, if we want to do justice to our job. So that is very clear. So we know that if I'm not able to keep my biases aside, if I'm getting carried away, I know I need to work on myself. Right? Same way, if I know that I am not able to focus and not able to observe, which Hahnemann has said that we need to be an astute observer. So it means that maybe I am fatigued, I need rest, I am burned out. Right? So we already have some guidelines to evaluate ourselves, that am I doing fine for myself as a homeopath itself, right? Coming to the homeopathic psychiatry, if you have studied homeopathic psychiatry and you're a practicing homeopathic psychiatrist, again, you will understand better ki, okay, I think I am having symptoms of depression. So maybe let me connect with my mentor and take my similimum, or let me connect with my physician. To that extent, I would even say that since we know even the scope and limitations of homeopathy, right? Sometimes when we have started homeopathy and it is not helping us, there's no problem in switching on to allopathic meds also.
Agree.
Because what is important is being fine, both mind and body wise, right? And let us not discriminate ki allopathic medicines अच्छे नहीं होते, they're addictive and all that.
Agree.
These are myths. Allopathic medicines given by a right psychiatrist in right dosage at right time with correct diagnosis also can be helpful. Right? So the point here is that if you're a homeopathic psychiatrist, you will know better what you're going through, even clinically. So take that step. Okay? Help yourself out. either via homeopathy or by consulting a psychiatrist. Don't try to self-medicate is always my opinion. मुझे लग रहा है नाट्रोम्यूर जैसा पिक्चर है मेरा तो मैंने नाट्रोम्यूर ले लिया. Of course, I'm not against it. But then biases, aren't we ourselves biased about ourselves? Right? Do we really know everything about ourselves? Not really. If you want to test it, just sit with another therapist or a counselor who is trained in psychology, or maybe another homeopathic psychiatrist, and they will probably show you the things that you were not aware about yourself. So what you're thinking that you were a natromure, you might come out to be aurum or something else. Right? So don't self-medicate. In fact, always take help of your senior physician if you want to go for homeopathy. Similimums can work wonders when it comes to psychological conditions, as I said. And if they're not working for you, do not suffer. Take whatever next best possible medicine is available. It could be an allopathic medication, or you may need to go into therapy. Go into therapy. Okay? Because, as I said that our self-doubt, inability to set boundaries sometimes comes via our deeper unresolved conflicts or deeper unmet emotional needs. So for example, imposter syndrome comes very often in people who are having over perfectionism or who are having problems deep down in their self-esteem. So your self-esteem needs to be worked upon, right? If it's a burnout, you need somebody's help to understand time management, to understand work-life balance. Right? If you're struggling with, say, boundary setting means what? Inability to say no. I always feel that the most liberating statement in this world, agar kuch hai, to that statement is, I don't know. Just yesterday, when I did my Ask Me Anything, somebody asked me about hyperprolactinemia, and I was like, I don't know. I have not dealt any case with it. Why take that extra pressure? I have met some of my colleagues or some of my friends who were like कि नहीं एक case है कभी मैंने treat नहीं किया मेरे को challenge लेना है. Who are we? I mean, honestly speaking, my thing is that, and that take challenges, that is okay. But then is it not an added on pressure when you lack the expertise, when you lack the understanding, and you are just taking to prove a point? I want to show कि भाई, see, I can deal any case, or I want to understand why you're taking certain cases, understand your scope and limitations, learn to say no. You don't have to fear कि अरे क्या बोलेगा शादी सर्दी खांसी भी ठीक नहीं करने है एलोपैथ के पास भेज दिया. Right? So out of that, we don't say no to patients. या क्या MD psychiatry है तो भी schizophrenia homeopathy से नहीं ठीक करने को आया. Why take that unnecessary pressure? Let us be okay with whatever we are. Let us learn to say no, because if you are not able to say no, it means that somewhere there is a lacuna of understanding criticism or accepting criticism. So that needs to be worked upon, and that you can work with a psychotherapist also. If suppose homeopathy is not helping you or similimum is not helping you. And why I say similimum may or may not help, because some of these are skills that you need to learn. Handling criticism, handling trolling is a skill that you need to learn in today's times. If you get a negative feedback, how not allow it to stick it to yourself. It's a skill that you need to learn. Untanglement from the thoughts, detachment from certain negative experiences is sometimes about skill. And then if it is about skill, medicine cannot, generate that skill. So some interpersonal relationships, as a doctor, you need to be good with interpersonal relationships, right? But if I am an introvert by default, medicine will not help me learn social skills, right? Boundary setting के लिए कैसे statements use करने हैं, how I should not sound arrogant. These are communication skills. They are called skills for a reason, because they need to be learned. Right? So don't even stay in that zone कि भाई I am a homeopathic psychiatrist, so I am an introvert, so मैं natromure ले लूंगी तो I will be good with social skills or IPRs. It doesn't happen that way. So rather than if you are dealing with your own problems psychologically, try to go for a right kind of approach. See where you lack. Understand that what you need. If you need similimum, you need a similimum. If you need therapy to build skills, you need therapy. Right? If both are not helping, sometimes you might need allopathic medications. And I don't shy here. When my son was diagnosed with autism and I was not able to deal, I was taking homeopathic for myself. I was taking therapy. But then I was just not able to come out of that trauma. And I did take short help of allopathic medications. It helped me, and then I was fine. right? So be very open, be vocal. Let us normalize these conversations. Recently I had put up a post where I was really not doing fine mentally. And I told my patients clearly that I need a mental health break today. Okay. I did not lie that मेरे को बुखार आया है या मेरी तबीयत ठीक नहीं है. I made it very clear that why I can't take a session, because mentally I don't feel I am at the right zone today to take the session. And honestly, my patients took it very positively. We have this thing that whenever somebody calls up and you are maybe crying just a minute ago, and somebody calls up and we take the phone and we say, the person asks us that, how are you? And we say, I'm good, right? But can we start saying that, no, I'm not good, but for the purpose of the call, I can speak? No, can we normalize this? So that is something that, and who will do that? We have to do it as doctors first. हम लोग नहीं करेंगे तो पेशेंट्स क्या ही ओपन अप होंगे और क्या ही करेंगे खुद की मेंटल हेल्थ को लेके, राइट? So that is something I feel that we need to do. As a homeopathic psychiatrist, we do have an advantage. But yes, integrative approach is what I always recommend. Or, customize what you need. Just as we customize for our patients, we have to customize it for ourselves also.
That kind of partly answers the next question, but also brings us to the point where we can ask as a society. When I say even myself, I am also part of the society. When I am approaching another doctor, what is that I can be mindful of? What is that I can do as a society to deal with the situation? I don't know how to put it, more positively, more constructively, so that it rather becomes an asset rather than a liability for both parties.
Yeah. So, patient education is important, as I said, that because today is the era where availability है. अगर if मैं online दिख रही हूँ WhatsApp पे, obviously my patient will be tempted to, कि doctor, I'm not good, or I need help. So not even patient's fault for that matter, but because nobody knows in today's world how to navigate through this constant availability which digital technology has provided us, right? So it is always okay to tell your patients that these are my timings, or use your social medias to clearly communicate ki, for emergencies, contact so and so number. WhatsApp is only available from say morning 9 a.m. to evening 5 p.m., whatever. So set those clear boundaries verbally. And even if patients sometimes may not understand, or because for every patient, their need seems like an emergency, right? So again, we have to be okay if it comes with some criticism ki, doctor doesn't understand me. No, because again, not their fault. जब भी जान पे आती है तो सबको ही चाहिए कि मुझे best medical help मिले, right? But then we have to also know that we are doctors and we are not gods. Okay, we are not superhumans. We don't need to be superhumans, right? So it is okay if some patients get upset. We can always apologize for not being there. At the same time, offer them the help, but not be available out of that fear that what others will think or what patients will think. Okay, so out of your availability, yes, there are certain cases. For example, in psychiatric practice, we do have suicidal patients there. So we ourselves tell to the family or the relatives that let me know or give me an update at night also. Because those are real emergencies, those are real medical emergencies, right? But beyond that, I think as a society also, patients slowly will understand if we take that initiative to explain patients, to create awareness about the availability. Okay, secondly, boundary setting also comes with a lot of other things in medical practice, that we need to educate our patients about the charges that we take. There's always a comparison that patients put up. I remember in early years of my practice, I had this patient who was an asthma case, and she told me, doctor, why are you charging 200 rupees? This was 10 years ago. Why are you charging 200 rupees that outside van maybe homeopathic medicines milte, wo 30 rupees mein dete? Right? So I said, see, this is my charge. I'm sorry if you can't afford it. If you feel comfortable, you can always go there. I don't have any issues, but I'm sorry, I cannot come down. So politely, you can always say, the patient left with anger, doesn't matter. But she did come back to me again. right? So the point is we get too afraid, too scared to set those boundaries, but you have to set it. Only then the community will change. If we don't do that, how will they understand? Right? So as a community, you can set those boundaries in all the areas when it comes to availability, when it comes to charges, when it comes to, comparing ki, but Google said this or so and so doctor said this. Why are you recommending this therapy? Or why are you recommending only this? Everywhere you don't have to over explain. You can say this is how it is. If you're not okay, let me know. I will see what I can do. But if it is not possible for me to not suggest a particular therapy, you may continue with the other doctor. Right? So those boundaries need to be very clear and it needs to start from us. We have to start ourselves saying no. नहीं तो वो कभी नहीं आएगा. Okay? So yeah, that is what I feel. Again, one more thing that I forgot to mention about the imposter syndrome. How to deal with that is also stick for legitimate feedbacks. Okay? When you feel you're not doing adequate, you're not good enough, or when patient comes and says, how come doctor you were not available, you're not a good doctor, and you start self-doubting, connect with somebody from where you will get legitimate and sensible feedbacks. And that is why I suggest that every doctor must have his or her own mentor with whom they are in constant touch. Okay, not necessarily a therapist or a counselor, but a mentor with whom they can be in constant touch, a good mentor. Right? So agar mentor, if he or she guides, then it is very easy to get that neutral picture, to understand that, okay, it's not all about me, it's not my fault. And that assurance is sometimes needed in our practice. That no, I am good enough. Those reaffirmations, not just from ourselves, but also from our mentors are needed. Right? So having a good mentor is extremely essential. Sometimes I feel when you are in the medical profession.
Fantastic. All points covered. It also brings newer ideas to my mind of, asking you for other topics to speak about. Certainly,
Yeah.
for later. For now, I will request the audience to share their feedback in the comments, in the live video, in the posted video later on. And also, if you have any questions right now, in the next couple of minutes, we will take those questions. Even if you have questions later on, you can leave them in the comments. You can DM Dr. Ananya. She's available on Instagram. So
yeah, my boundary setting is that maybe I might not be able to answer all, but whenever I check, I will definitely answer.
Fantastic. Yes, yes, yes. So,
Yeah.
I understand. English में हम करेंगे. The idea of doing it in English is so that कि pan India globally सबको ये चीज समझ में आए. But definitely we'll have topics कि हम उसे हिंदी, इंग्लिश या और local languages में try करेंगे.
Yes.
I guess no questions so far.
Yeah. Okay. So, yeah, no
Wonderful
questions.
having you. As always, a lot of enlightenment, lot of knowledge. Thank you once again from on behalf of HomeoMitra. We'll meet with.
Sorry to interrupt. Can I just share a quote that I want all
Yes,
doctors
please.
to remember?
Yes.
Okay. So, in our one of our therapies, we always use this quote. It is a very good affirmation. So that quote says that, oh God, grant me serenity to accept the things that I cannot change, and courage to change the things I can, and wisdom to know the difference between the things I can change and I cannot change. So this quote is something which I think if we remember, a lot of our stresses will go down as a doctor. So I always start my day with this quote कि भाई मेरे बस में क्या है क्या नहीं है, let's be clear about it, and rest let me accept जो नहीं है बस में नहीं है बस में, it is okay, छोड़ दो. Okay, so yeah.
That distinction is really important and a very, very inspiring quote.
Yeah. So yeah.
All right. Thank you, Dr. Ananya. Once again, thank you to the audience for having listened to this podcast. Please share this with everyone. Understand this is not just for homeopaths, it is for all doctors. And it was meant for all doctors. So whoever wishes to share with their colleagues, their friends, family, please do. And do share your feedbacks in the comments. Do ask us the questions if you have in the comments.
Yeah.
All right. So HomeoMitra signing off. Thank you all once again.
Thank you so much. Goodbye, everybody. Thank you.
Thank you. Bye.